I have had the surgery. It has been a month. It's a month post-op. I know I haven't gotten a video out in a while. I've been real busy. A lot of stuff on my plate right now. I feel great. And I kind of want to tell you a little bit about the surgery, what happened, what I went through. Number one, my mom and dad came up for the surgery. And that was great. That was awesome. Let me fix my tie a little bit. It looks kind of weird. That was great. My mom and dad came up. My mom and dad were just great. Then they came up the day before surgery. Okay. And that was fine. I enjoyed having them come, even just the day before. I would love for them to have come several days before, but it's okay. They came. And that's the most important part. So, some things I had to do before surgery. Number one, I had to drink this apple juice that had, well, actually I drank white cranberry juice that had the sugar in it. And so I would have thought they wanted me to drink sugar-free, but no, they wanted me to drink the white cranberry juice with sugar in it the day before surgery and the day of the surgery, the morning of. Because they say that the sugar in it helps you pull out of the anesthesia. Thank the Lord, I'm alive. But, and that was great. So, Mom and Dad came in, flew in. They had I don't think they had any trouble flying in. They had a couple of layovers, but they got here. And I had some wipes. I had to wipe my entire body down with after my shower, and the morning of my surgery before I left. I had to be at the hospital. My surgery was at 7:30. I had to be at the hospital at 5:30. So we got up, we went. It was morning. I'm not a morning person, but I woke up and was ready to go. I was so nervous. I'm like, Lord, if you're ready to take me, okay, my bags are packed. But I don't want to go yet. And so, that was great. Early in the morning, got there, 5:30, and they put the IV in, and I swear, they tried like several times to get a IV going in my hand, in my arm. They finally got one up here, and that hurt. Good granny, that hurt. And then they had one in my hand over here, and so about 6:45. We're all sitting in this room. My pastor came. Pastor Lamar, thank you so much for coming. That was amazing. He came and prayed with me before. My folks prayed with me beforehand. And that was great. But about 6:45, they called me back. I had this, I don't know what you call it, a gown on, and I had to take it off. I mean, they can't cut through the gown. And so, I laid down in this gurney, and they put a mask on me, and then they put the IV in, and that's all I remember. I woke up thinking, we need to get this show on the road, because it's cold, and all of a sudden I'm sitting there like, I'm in pain. What's going on? And then all of a sudden this voice out of nowhere, welcome back, you're done. I'm like, what are you talking about? I'm done. Didn't wake up during surgery. I made it through. Did not see St. Peter when I woke up. So I'm alive. But that went great. Was in the hospital for about 3 days, I believe. It's been a month um, since surgery. And so I was in the hospital for about 3 days, 2 nights and 3 days, I believe. And that was amazing. My entire time at Avera was... My time with the Avera Hospital was amazing. So if you were thinking about having the gastric sleeve or the gastric bypass or any surgery at all, Avera McKinnon in Sioux Falls, South Dakota, it's great. I mean, I loved it. I don't enjoyed the pain of the surgery, but just the time that I had with the nurses coming and checking on me, this and that, and the relationships that I created. I still have people calling me from the hospital. How are you doing? How's everything going? And it's not a routine call. They just want to see how I'm doing, and that's great. I've never had that with a doctor's office or a hospital at all for anything. And so, but anyways, so yeah, surgery went great. I had a little bit of pain eating food after surgery. I know a lot of people want to know about that. I had a little 1 ounce cup. Excuse me, I'm going to go get the cup. I'm going to show you what I had to go through. I apologize. This little medicine cup, 1 ounce. That's a 1 ounce cup, folks. It's smaller than a shot glass. And so the only thing I could have post-surgery, I had Jello in it, and we had to measure the Jello inside of it. I had to have pudding, measured the pudding in there. Broth, had to put in that, had to measure that in there. I did have a cup of hot coffee. A 1 ounce cup of hot coffee like 2 days after surgery. And I think that might have been the best tasting coffee I've ever had. Hospital coffee from Avera McKinnon in Sioux Falls. But 1 tiny little ounce of anything filled me up to where I felt like I was so bloated. I was like, don't give me anything else. And I never thought in my wildest dreams that would ever happen. And that was called the stage 1 diet. Post-surgery. Post-surgery stage 1 diet. And then I went to the stage 2 where I could start having cottage cheese. 1 ounce of cottage cheese. And ground up like chicken. 1 ounce of that, and that was great. And that was the second week. I went back for my 1 week post-op. It was great. I had lost about 30 pounds in 1 week. And so, and that was great. Let me back up from that. No, it was about 30 pounds, absolutely. And so, when I weighed 515 the day of surgery. And so, post-op, I had lost 30 pounds a week. And so, and then I went on to the stage 3 diet. And that was 3 ounces. My mom got me these little lunch dishes that measured 1 ounce, 2 ounce, 3 ounce, and I still use them now. And, but of course, I mean, it's still fresh. It's just a month. But, and the weight, oh my gosh. I'm going to talk about that in a minute, but it sheds. Holy mackerel, it sheds right off. And so, the stage 2, when I talked about the stage 3 was 3 ounces. And I could start introducing some more meats and this and that. Same thing I was eating before in stage 2, but it's a little bit more. And then, and now I'm on stage 4, so I don't really have any more restrictions. And kind of like somebody told me, go ahead and eat what you want. I mean, except for like pasta, rice, bread. I just started introducing crackers and very toasted toast to get all the moisture out. But I can start having soft lettuces like butter lettuce, leaf lettuce, outsides of romaine that's real soft. Because, you know, vegetables and stuff are so hard for your body to digest. And so, like, when I was having, if I had onions in something, it had to be cooked down to mush. Like a can of green beans, cooked even more mushier. But I'm introducing more stuff. So I'm eating about 4 ounces of food. And it fills me up. Oh my goodness. 4 ounces. That's a little cup of, the little Jello cups. That's about all I can eat. And so, I haven't tried chicken and stuff. Like I had a chicken strip the other day. And then it has breading on it. But I can't eat very much of it. And so, like I said, I've introduced some stuff. But, like somebody said, go ahead and eat what you think you can. Your body's going to let you know what you can and cannot eat. And so, your learning curve is yourself. Because my body, especially if I'm eating something, and my mom also got me these little baby plates, baby bowls, and a baby spoon. And you've got to use them, I'm telling you. If you take too big of a bite, your body's going to let you know. Trust me. And so, with that 4 ounces, as soon as I start to feel full, you start to feel this pain right in the soft spot of your chest, where your chest meets your stomach. Like you got uppercutted in the stomach. Not too hard, but I mean, you feel the pain. And you're like, oh, better stop. And if you're chewing, if you're in mid-chew in a bite, it has to come out. Because you swallow that little bit more, it's going to hurt. And I learned that the hard way. And so, but I mean, that's okay. I'm learning. I know what I can, what I can't do. And so, I go for I have my 1 month checkup on the 1st of October. Looking forward to getting that done. Looking forward to going and getting, I don't want to say getting out of the way, but I'm excited to show the doctor what I've lost. Now I've lost about 55 pounds. And I guess this shirt, I bought a month before surgery like an idiot, but I got it on sale. And so, and it was so skin tight. That's about how tight it was. But now, it's loose. It looks sloppy on me, I feel like. The arms here are sloppy. But my body's, I can tell the changes. I'm not having to lean backwards from leaning forwards. Not have all this weight for me doing this. Because, I mean, I'd sit there and waddle like that. I have so much weight. And, excuse me. But, I was in the bathroom the other night. I reached to go grab something. And I looked here on my underarm. And the skin is just drooping down. I'm like, good Lord, already? And so I jiggle it. I mean, it just waves. I feel like Dumbo's ears. And I'm going to get personal with you here. My chest, all my rolls that I had are just sagging down. My stomach is sagging down from excess skin. Because I've lost a lot of weight so far. And I don't know if you can tell in my face. Everybody else says they can. And so somebody said, because I've officially lost 100 pounds since March. And people keep telling me, Oh, yo, man, I can really tell in your face you've lost 100 pounds. Good granny. How big was my head to begin with? 100 pounds. But all joking aside, that's exciting. How many people can say they've lost 100 pounds? I can. And it's a great feeling. And something else that this surgery has done, it has made me care about my appearance. A shirt and tie, and this is not just something that I just put on for this video. I dress like this every day now. And people notice. In fact, somebody told me in the little town that I live in, you're probably one of the best dressed men in this town. I'm like, thanks. And so, I wear a nice watch. Don't have a lot of money to spend on expensive watches, but hey, it's a nice watch. I like it. And so, I wear cufflinks with this shirt. And they're not the most expensive ones, but I mean, they're nice, and I really enjoy them. It makes me look better. And so, I want to look better. I want to better myself. And so, if anything else besides just weight loss, it's bettering myself. Making myself feel better about who I am. I mean, because I've suffered from depression for years and anxiety. And I will say this, I have had some anxiety after the surgery, but I understand that that's kind of normal. But I'm getting that taken care of. And something else, dizziness. Oh my goodness, you stand up too fast, stood up too fast the other day, and my aunt, she told me about this. I stood up, got lightheaded, plopped back down, and said, goodness. Because your veins got so big when you were overweight, so overweight. And now that I've lost a lot of weight, those veins haven't shrunk yet, so when I stand up, blood just flows. And you just about pass out. But now my organs are moving back where they belong, and that's causing dizziness. And, in fact, a week after surgery, I got so dizzy I had to hold on to something because for sure I was going to pass out. But everything was fine. First thing I did was call my dad before he got on the plane. I think I'm dying. But it was great. So I know this has been a long video. Definitely one of my longer ones, but it's so exciting. Everything. And so, I mean, I feel so much better about myself. I feel better. I know I look better. And everybody keeps telling me, all the compliments, you're looking so good. I can tell you've lost weight. And man, that is a great feeling for people to come up to you and say, what are you doing? Or what did you do? I explained to them, I had gastric sleeve surgery. I have bariatric gastric sleeve, and it has saved my life. Folks, I love you. Jesus loves you. I'm out. You have a good day.